We are witnessing the biggest measles outbreak America has seen in decades, and it's spreading fast. As of this morning, 876 confirmed cases have been reported in South Carolina alone, making this the largest measles outbreak in the United States since the disease was declared eliminated back in 2000. But here's where this gets even more alarming. The virus has now breached federal immigration and customs enforcement detention facilities in both Texas and Arizona, raising fears of rapid spread in crowded, confined conditions where families and children are being held. Health officials are scrambling, vaccination rates are plummeting, and experts are warning we could lose our measles elimination status from the World Health Organization within weeks. This is not a drill. This is a full-blown public health emergency unfolding across multiple states, and the convergence of declining vaccination rates, immigration enforcement, and policy failures is creating a perfect storm. Stay with me because what's happening right now could affect every single American, vaccinated or not. Let's start with the numbers because they're staggering. South Carolina's Department of Public Health reported on Monday that the state now has 876 confirmed measles cases, up 29 cases from Friday. This outbreak started back in October 2025 in the upstate region, specifically centered around Spartanburg County, which accounts for 841 of those cases. That's 96%. Within just 16 weeks, this outbreak surpassed last year's massive outbreak in Texas, which had 762 cases and was considered the worst in modern times. Now, South Carolina has blown past that number, and the outbreak is still growing. There are currently 354 people in quarantine and 22 people in isolation. The latest projected end of quarantine for these cases is February 24th, which means we're still weeks away from potentially seeing this thing contained. Here's what makes this so dangerous. Of those 876 cases, 800 people, that's over 91%, were completely unvaccinated. 16 people were partially vaccinated with just one dose of the recommended 2-dose MMR vaccine. Only 22 people were fully vaccinated, and the vaccination status of 38 people is unknown. This is not a mystery. This outbreak is happening because vaccination rates have dropped below the critical threshold needed for herd immunity. Experts say you need 95% of the population vaccinated to prevent measles from spreading. South Carolina's kindergarten vaccination rate for 2 doses of MMR has dropped from 95% in the 2019 to 2020 school year down to 92.1% for the 2023 to 2024 school year. That might sound like a small drop, but when you're dealing with one of the most contagious viruses known to medicine, that gap is catastrophic. The age breakdown of cases is heartbreaking. Almost 2/3 of the cases, 555 people, are children between the ages of 5 and 17. Another 233 cases are in children under the age of 5. That's 788 kids affected by this outbreak. 71 cases are in adults 18 and older, and 17 have an unknown age. We're talking about entire school populations being exposed. The Department of Public Health has identified numerous locations where infectious measles exposures occurred, and the list is massive. Restaurants, grocery stores like Food Lion and Walmart Neighborhood Market, schools, churches, even a hospital maternity unit. People are going about their daily lives, shopping for groceries, eating at restaurants, taking their kids to school, and unknowingly coming into contact with this virus. State epidemiologist Linda Bell told reporters on Wednesday that while the number of new cases has slowed in recent days, down to just 29 new cases reported Tuesday compared to 54, 58, 88, and even 124 new cases in previous weeks, it's still too soon to say if the trajectory of the outbreak has finally turned a corner. They're cautiously optimistic but not declaring victory yet. And here's why they can't celebrate. Measles has an incubation period of 7 to 12 days, but symptoms can appear up to 21 days after exposure. That means someone who was exposed 2 weeks ago might only now be starting to show symptoms. And during that time, before they even know they're infected, they've been contagious and potentially spreading the virus to everyone around them. A person with measles is contagious 4 days before the rash appears and 4 days after. The virus can linger in the air for up to 2 hours after an infected person leaves a room. Think about that. You could walk into a grocery store 2 hours after someone with measles was there, breathe the same air, and get infected if you're not immune. There is some good news, though. Vaccinations have surged in response to this outbreak. Linda Bell reported that vaccinations in Spartanburg County, the epicenter, were up 162% in January compared to last year. Statewide, vaccinations increased 72%. The Department of Public Health has activated mobile health units offering free MMR vaccines at no cost. They're going into communities, setting up at churches, community centers, trying to reach people who haven't been vaccinated. This is what public health response looks like when an outbreak is already out of control. It's reactive, it's expensive, and it requires massive resources that could have been avoided if vaccination rates had stayed high in the first place. Now, let's talk about what's happening at ICE detention facilities, because this is where the measles outbreak intersects with one of the most controversial policies of the Trump administration. Over the weekend, the Department of Homeland Security confirmed that 2 detainees at the South Texas Family Residential Center in Dilley, Texas, have active measles infections. This is the nation's only current immigrant family detention center, located about 70 miles south of San Antonio. Federal officials immediately halted all movement within the facility and implemented quarantine measures for anyone suspected of contact with the infected individuals. DHS spokesperson Tricia McLaughlin said in a statement that ICE Health Services Corps took immediate steps to quarantine and control further spread. But here's the problem. These measures only happened after exposure had already occurred. How many people were exposed before those 2 cases were identified? We don't know. The facility houses families, including children, in close quarters. Measles spreads like wildfire in congregate settings. Dr. Katherine Peeler from Harvard Medical School, who has extensively studied healthcare in immigration detention centers and is a medical expert with Physicians for Human Rights, said she is very concerned. She pointed to a 2016 measles outbreak at an ICE detention center in Arizona that resulted in over 30 cases among detainees and 9 staff members. Dr. Peeler said, "I am very concerned that we're going to see higher rates of measles outbreaks the same way that we saw very high rates of COVID, both in adult detention centers as well as family detention centers." And as vaccination rates decline across the country and the U.S. sees more measles cases, as well as more people detained at ICE facilities, the risk of outbreaks grows. It's not just Texas. In Arizona, the Department of Homeland Security confirmed on January 21st that a Mexican national detainee housed at the Florence Detention Center in Pinal County tested positive for measles. 2 more measles cases have since been confirmed in Pinal County, bringing the total to 3 cases. The facilities have ceased all movement and quarantined individuals suspected of contact with infected persons. But here's what's alarming advocates and public health experts. People are still being released from these facilities even as quarantine measures are supposedly in place. Anna Keating, an advocate who works at a Phoenix shelter that receives detainees after they're released from Florence and Eloy, told reporters that as of last Friday morning, the location of the measles cases was unknown to her organization. She said, "We sent people to Philadelphia and Newark on Tuesday on a Greyhound bus," referring to detainees from Eloy. If people are being released and transported across state lines during an active outbreak, potentially carrying the virus with them, this could seed outbreaks in communities nationwide. Immigration detention facilities are public health disasters waiting to happen. Between 2019 and 2023, a case series documented sustained transmission of influenza with 2,035 cases, mumps with 252 cases, and hepatitis A with 486 cases across 20 ICE facilities. Another study from 2017 to 2020 found repeated prolonged transmission of influenza with 1,280 cases, varicella, which is chickenpox, with 1,052 cases, and mumps with 301 cases across 17 detention centers. Nearly half of all reported infections, 44.7%, occurred at the South Texas Family Residential Center in Dilley, the exact facility that now has measles cases. Crowding and frequent transfers between facilities drive outbreak persistence. You're taking people from different parts of the world with different vaccination histories, cramming them into close quarters with inadequate health care, and then moving them around the country. It's epidemiologically insane. Dr. Bruce Rogers, president of the Greater San Antonio chapter of the American Academy of Pediatrics, sent an urgent letter to public health officials warning that in this setting, the public health emergency is more dire than a typical outbreak because congregate detention creates near universal exposure risk. He said this has the potential to quickly overwhelm local health resources, including San Antonio's University Hospital. Congressman Joaquin Castro, a San Antonio Democrat who visited the Dilley facility, urged federal officials to immediately shut it down. He posted on social media because of the close quarter conditions at Dilley, lack of prompt medical response and capacity, and lack of expertise with diseases such as measles. Dilley is not equipped to combat any spread. He noted that ICE confirmed no one detained at Dilley faces criminal accusations. They only have immigration offenses, which are civil matters, not criminal. Let's zoom out and look at the national picture because South Carolina and the ICE facilities are not isolated incidents. The Centers for Disease Control and Prevention reports that as of January 29th, there have been 588 confirmed measles cases across 17 sites nationwide in 2026. Last year, 2025, saw 2,267 measles cases in the United States, a sharp increase from just 285 cases in 2024, we're seeing exponential growth. The second largest outbreak after South Carolina is in the neighboring border towns of Hilldale, Utah, and Colorado City, Arizona. Cases there have spread into urban areas of Utah. As of the latest count, Utah has 48 cases and Arizona has 34 cases this year, adding to the 423 cases those states saw last year. The measles strain in the Utah-Arizona outbreak is different from the one that spread in Gaines County, Texas last year, meaning we have multiple strains circulating in different parts of the country. There's also an outbreak at Ave Maria University in Florida with 12 confirmed cases on campus, 4 of whom required hospitalization. Hospitalizations have occurred in about 3% of measles cases reported in 2026, and so far there have been no deaths reported this year. But that's cold comfort because last year's Texas outbreak saw 2 children die and 99 people hospitalized. Measles kills. It causes brain damage. It can lead to permanent disability. And even if you survive without complications, measles resets your immune system, making you vulnerable to other infections for years afterward. This is not a benign childhood illness. It's a serious, potentially fatal disease that we had nearly eradicated through vaccination. The CDC reports that in 2025, 97% of people who got measles were unvaccinated. This is preventable. We have a vaccine that is safe, effective, and provides durable immunity for most people with 2 doses. The vaccine costs less than $2 per child. $2. That's what it costs to prevent this suffering, these hospitalizations, these potential deaths. And yet, vaccination rates are plummeting. Why? Misinformation. Vaccine hesitancy fueled by social media conspiracy theories and, frankly, irresponsible public figures spreading doubt about vaccines. Robert F. Kennedy Jr., now serving as health secretary under President Trump, has a long history of promoting anti-vaccine views. His organization, Children's Health Defense, has pushed false claims that vaccines cause autism, that measles outbreaks are caused by vaccines themselves, and other debunked theories. During the Texas outbreak in February 2025, anti-vaccine activists blamed the outbreak on vaccines. That's like blaming firefighters for fires. The United States is in real danger of losing its measles elimination status from the World Health Organization. That status requires that there be no continuous transmission for at least 12 months. The WHO decision is expected to come in April. If we lose that status, it will be a massive public health failure and an international embarrassment for a country with the resources and medical expertise we have. Between 2021 and 2024, measles cases each year ranged from 49 to 285. This year, we're already at 588 cases as of late January. We're on track to potentially see thousands of cases by the end of 2026 if current trends continue. Rebecca Sonnenschein, medical director of the Arizona State University Health Observatory, said there is a very clear threshold for herd immunity, and that is 95%. When vaccination rates drop below that, measles exploits the gaps. It finds the unvaccinated children, the infants too young to be vaccinated, the immunocompromised individuals who can't receive vaccines, and it spreads through those vulnerable populations like wildfire. That's what we're seeing in South Carolina. That's what we're seeing in ICE detention facilities. That's what we're going to see in more and more communities across America if we don't reverse course. So, what's being done? In South Carolina, public health officials are working around the clock. They're contact tracing every case, identifying exposure sites, notifying the public, offering free vaccinations. They've posted detailed lists on their website of every restaurant, store, church, school where exposures may have occurred, along with specific dates and times. If you were at Mariachi's Mexican restaurant in Sumter on this date at this time, monitor for symptoms through February 13th. If you were at this Food Lion or this Walmart, watch for symptoms through February 14th and 15th. The level of detail is impressive, but it's also overwhelming. There are so many exposure sites that it's nearly impossible for the average person to keep track. The mobile health units are a good step. Bringing free vaccines directly to communities removes barriers like cost and transportation. But it's still reactive. We're vaccinating people after the outbreak has already exploded when we should have been maintaining high vaccination rates all along to prevent outbreaks from ever starting. Prevention is always cheaper, more effective, and less disruptive than outbreak response. Always. In the ICE facilities, the response has been questionable at best. Movement within facilities has been halted. Quarantines have been implemented, but these are measures that should have been standard operating procedure long before measles arrived. Immigration detention facilities should have vaccination screening and vaccination programs for everyone entering the facility. They should have isolation units ready for infectious disease cases. They should have robust healthcare staffing and resources. Instead, we have a system where people are crammed together, healthcare is inadequate, oversight has been reduced under the Trump administration, and now we have measles spreading in facilities that house families and children. The fact that people are still being released and transferred from facilities with active outbreaks is unconscionable. If you release someone who was exposed to measles but doesn't yet show symptoms, they get on a Greyhound bus, they travel across state lines, they might visit family, stay in shelters, and they could seed outbreaks in entirely new communities. This is how a localized outbreak becomes a national crisis. Here's what measles symptoms look like. They typically begin 7 to 12 days after exposure but can occur up to 21 days later. Initial symptoms include cough, runny nose, red watery eyes, and fever. 2 to 3 days later, a rash appears that starts on the face and then spreads to the rest of the body. If you or your child develop these symptoms and you know you may have been exposed, do not just show up at a doctor's office or emergency room. Call ahead. Let them know about the exposure and symptoms so they can take precautions like having you enter through a separate entrance, isolating you from other patients, having staff wear masks. You don't want to sit in a crowded waiting room and expose dozens of other people. If you're unsure of your vaccination status, get vaccinated. The MMR vaccine is safe. Serious side effects are extremely rare. The most common side effects are a sore arm, mild fever, maybe a rash. Those are temporary and minor compared to the risks of actual measles. If you're a parent and you've been hesitant about vaccinating your child because of things you've read online, I'm begging you, talk to your pediatrician. Look at credible sources like the CDC, the American Academy of Pediatrics, peer-reviewed medical journals. Don't get your medical information from social media influencers or conspiracy theory websites. Your child's life could depend on it. This outbreak is exposing deep cracks in our public health infrastructure. Decades of underfunding, erosion of trust in public health institutions, the politicization of vaccines, and now policy choices that confine vulnerable populations in conditions ripe for disease transmission. We have the tools to stop this. We have the vaccine. We have the medical knowledge. What we're lacking is the collective will to prioritize public health over politics and misinformation over science. The 876 cases in South Carolina, the cases in ICE facilities, the cases spreading across multiple states, these are preventable tragedies. Every single one of them. Parents are watching their children suffer. Healthcare workers are stretched to the breaking point. Public health officials are working overtime trying to contain an outbreak that didn't have to happen. And all of it could have been avoided if we had maintained the vaccination rates that protected us for decades. So here's what you need to do. Check your vaccination records. If you're not sure if you're vaccinated, ask your doctor to run a blood test to check your immunity, or just get vaccinated again. It's safe, even if you've already been vaccinated. If you have children, make sure they're up to date on their MMR vaccines. The first dose is recommended at 12 to 15 months of age, the second dose at 4 to 6 years. If your child is older and missed doses, they can catch up. If you're traveling, especially internationally, make absolutely certain you and your family are vaccinated. Measles is still common in many parts of the world, and travelers continue to bring it back to the United States, where it finds unvaccinated communities and spreads rapidly. If you hear someone spreading misinformation about vaccines, push back. Share accurate information. You don't have to be confrontational, but you can say, actually, I looked into that, and here's what the science really shows. Sometimes all it takes is one person providing facts to counter misinformation and prevent someone from making a dangerous decision for their family. This outbreak is a warning. It's showing us what happens when vaccination rates drop, when public health is underfunded and deprioritized, when policy creates conditions for disease to spread. We can turn this around, but it requires action from all of us. Get vaccinated, make sure your family is vaccinated, support public health initiatives, and demand better from our elected officials. We deserve a healthcare system and immigration system that protects public health, not one that creates breeding grounds for preventable diseases. The 876 cases in South Carolina will keep climbing unless vaccination rates increase dramatically and quickly. The cases in ICE facilities will spread unless conditions improve and vaccination programs are implemented. And more states, more communities, more families will be affected unless we wake up and take this seriously. Measles was declared eliminated in the United States in 2000. 26 years later, we're facing the biggest outbreak in decades. That's not progress. That's failure. And it doesn't have to be this way. Stay informed, stay vigilant, and most importantly, stay vaccinated. This has been breaking coverage of the measles outbreak crisis. I'll continue to monitor this situation and bring you updates as the outbreak develops. Please subscribe to this channel and hit the notification bell so you don't miss critical updates. Share this video with your family and friends because everyone needs to understand what's happening and what's at stake, and leave a comment below. Are you concerned about this outbreak? Have you or your family been affected? Let's have that conversation. Thanks for watching, and please protect yourself and your community.